So now we'll go over tracheostomy tube care. You've got a few different types of tracheostomy tube kits and so forth. They may have, I tend to always like to have a bolus of saline or saline syringe with me when we do this. But you've got your complete tracheostomy care kit. This actually comes with hydrogen peroxide, what have you. You could fill one of these up. I would be more apt to utilize one of these if in the event I were having like a Jackson trach, the metal Jackson trach. Not to say that you won't ever encounter those, but a lot of the ones now are these disposable at Portex, what have you, tracheostomy tubes in the clinical setting. So if you open your tracheostomy tube care up, again, always explain to your patient what you're going to be doing with those individuals. And you can see you've got a set of sterile gloves that come up on the that come in the package. You've got some water or normal saline, so you can fill one of these trays up with normal saline, fill the other tray up with the peroxide pouches that come in here. You can tell your patient what you're going to be doing. For the most part, you know, if you were going to be putting the inner cannula and stuff back in there, so this can be an aseptic procedure or a clean procedure rather than a sterile procedure, because I'm not going to pull this entire tracheostomy tube out. Now, if it were Jackson trach, you may take the inner cannula out. You may pull the whole inner cannula out, or excuse me, the whole tracheostomy tube out, clean it off, and put it back in. But chances are, if it's a Posey or Shiley and you needed to do a tracheostomy tube change, you're just going to pull the old out and put the new back in. But what you'll see primarily in the hospitals, make sure that you've got, and just to show you the contents of this particular tracheostomy set, you've got your sterile gloves, which these are no longer sterile because I've touched them. You've also got a sterile dressing, so if you needed to drape over the chest so that you could lay stuff down after you've cleansed it or what have you, good to go. You've got 2 pouches of hydrogen peroxide. You fill one channel up with that. This provides another set of trach ties, if you will, so you could put this behind the head if you wanted to. So fill one side up of the tray with normal saline, one side up with your hydrogen peroxide. And on the inside of this, you've got a pipe cleaner. So in the event you needed to clean that inner cannula out, or you needed to clean the actual lumen of the tracheostomy tube, now do not run this down there with the tracheostomy tube in the patient. This would be for running through the tracheostomy tube or your inner cannula while you've got that out of the patient. So if it were the metal Jackson trach, you'd be utilizing this an awful lot. There's also some pipe cleaners that can be used, and some of the procedures may change up a little bit depending upon where you're working at. You've got some sterile gauze so that you can wipe around the stoma site, and then there should be another tracheostomy tube dressing, and you may have some twill tape so that you can secure the tracheostomy tube again. So always check the site condition. So you can hyperoxygenate your patient, check out the site condition, and if you wanted to use hydrogen peroxide to damp your cloth with, or you want to use normal saline, pull this about, work this loose. If this happens to be stuck to the tracheostomy tube, you can take a saline bullet and kind of wet around there a little bit so that it works loose, because if it's been on there a little while or it hasn't been changed appropriately, you're going to have some secretions and mucus that have probably dried to this. You're going to have to pull it and work it loose. So pull that loose, and if you wanted to, you could take this. If your patient can withstand not having oxygen, you know, you can take that aside or keep it relatively close by in case you need to provide a little bit more. If your Posey's nice and clean, again, make sure that it's tight. You wouldn't necessarily need to change that, but if it's soiled, then you would want to go ahead and change that particular tie. Go ahead and wipe around and clean around the stoma site. Pull out your disposable inner cannula. Toss that, get a brand new one, put the brand new disposable inner cannula back in place, and after you've cleaned around your tracheostomy tube, then you can take your new trach sponge, slide this under the flange, because you really don't want that flange to rest just up against the skin. And again, we'll make it look nice and pretty for your patient so that they're well taken care of and well cleaned. If you needed to suction, you could have done that beforehand. You may need to suction again after, because after you tend to maneuver and manipulate that tracheostomy tube, it's going to move a little bit, may cause them to cough. My personal experience, Regardless of if your patient's on contact isolation or not, I would probably put on eyewear and a gown for this procedure, just because I was doing tracheostomy care on a patient one time, and it was a relatively fresh tracheostomy tube, and just the little bit of manipulation of that right there caused the patient to cough when they did. Stuff obviously comes out the tracheostomy, but it also shot around the flange. And with this flange being like that, so my forearms, everything got sprayed, and with it being a fresh trach, there was mucus and blood mixed in. So I decided from that point forward, when I did tracheostomy tube care, I would wear a gown. So then, discard your trash, and then return your patient back to the same amount of oxygen that they were on ahead of time or before you got started. And it goes without saying, you're going to monitor the patient's vital signs before, during, and after as well. Just take good care of your patients. Make sure that that's not too tight. And you want to make sure it's tight enough too, because time and time again, you might go into a patient room with a tracheostomy collar's been over here. Well, that's not doing them any good, because the aerosol is going to also help with the tracheostomy tube down here. You bypass the upper airway, so the heat and moisture that can be exchanged through the air that's being breathed in through the mouth and nose, you've bypassed that with the tracheostomy tube. So you want to provide some type of moisture, humidity content to the lower airways for the purpose of secretion mobility and things of that nature.